Today on Beyond the Image, I am speaking with Debbie, Billing Director and longtime SDMI employee. Welcome to the show.
Well, thank you. Good to be here, Miss Denielle.
Thank you. Thank you for being here. I'd like to start with your history with SDMI.
Well, my history really started with Sunrise Hospital and Dr. Leon Steinberg. And at that time, he had a little office on Rancho, 2300 Rancho Drive, and we had a little x-ray office, and they had techs that worked there, and all the billing that was done from Sunrise, we had to split it. And I thought, God, I want to go work at the office, because, you know, every week the girls were going, we got the afternoon off, and we're going to the mall, we're going shopping. I thought, oh, I can't wait. So when I came over to the office in 1971, the rules changed. There was no more afternoons off, and now we were working Saturdays. But it was fun. It was fun. It was a small, there was like 9 employees. So that's how we started. But, you know, originally it started at Sunrise Hospital with Dr. Leon, but he had a dream. And then one day when we bought the land, 2950 South Maryland Parkway, and he was so excited. And I remember I could hear him screaming, and I ran down the hall, and I'm like, what's going on? What's going on? And he's like, oh, we're going to build next to Sunrise Hospital. And I can remember, you know, being 19, 20 years old. I'm thinking, yeah, what are we doing? Because back then, it was really a lot of fun because he would teach you. He was really good at teaching you everything about radiology.
What is your favorite memory from the early years of SDMI?
Oh my gosh. I think some of my fun times was when Maryland Parkway, we were on the end of, I guess, the electrical box. And every so often a pigeon would fly into it and the power would go out. And we're like, oh my gosh, yay, we can take a nap. But they would get the power back up. And another time, you know, when it rains here, it floods. And if you know anything about going into Maryland Parkway office, when you go down the driveway, it's sloped. And the rain backed up against that brick wall behind there. And next thing we know, it's coming into the Maryland Parkway office, and we're looking all around and we're like, oh my gosh. And so we literally had water up to our knees. We had to roll up our pants leg. We had to help get the patients out, and, you know, they got a sledgehammer or something and began to knock holes in the wall behind so the water could go through. That was a lot of fun. That was a lot of fun then.
So one would assume back in the beginning, there were no computers, there was not a lot of the things that we have today. How has SDMI evolved and changed over the years?
We had an IBM Selectric typewriter, and we typed those insurance forms out right then and there, and you were allowed to use whiteout. And then the first time that we got a computer system, oh my gosh, we were like, yay, it's awesome on it though. And the monitors, it took 3 people to carry one of them. Yes, 3 people literally to carry it from here to there. And the billing office, we had to do the backup, and we had these huge reels where it would back up everything, and it would take hours upon hours. And we would come in starting at 2 o'clock in the morning to be ready to open up for 6. But it was fun, you know. It was a great shift because you got off at 10 or 11 in the morning. Yeah.
What has changed the most?
What's changed the most is the managed care, because it's good if the patients understand it, but a lot of them don't understand their plans. And so if you're in an HMO, you're assigned a PCP, a lot of times you can't go see a specialist on your own unless the PCP refers you. It's a lot of patients, they really just need to be more involved in it, you know, with their co-pays and trying to understand that we don't set the rules. We just try to make sure that we can go along with it, more or less, and try to help educate the patients about their plans. But we have limited information ourselves about, because each employer can design their own plan for it though.
What do you think is the biggest misconception about insurance from the patient perspective?
That the insurance is going to pay for everything. I don't have any out of pocket because I have insurance. And a lot of times when we're explaining the insurance to the patients, the easiest way to explain it is say, well, you know, you have a deductible with your car. They all get that. Oh yeah, well, you have one with your health insurance too. So once you reach that maximum amount that you've paid, then your insurance will kick in. And it depends upon the coverage. Is it 80-20? Is it 90-10? Or you may just have a copay, you know. But that's the biggest, because they think, well, I have insurance, why didn't they pay? Plus, all the insurances have come up with clinical guidelines, you know, if you're having this procedure, we'll pay for it, but this is what you have to do first. You have to have this test, you have to go to physical therapy, and then we may pay for an MRI, or we may approve the procedure. Yeah.
What advice can you give patients on understanding their insurance better?
To write down the questions that they normally call and ask us, and try to find out, call their employer HR, their benefits office, or if it's their spouse on it, get a broker to break it down. Read the paperwork that's given to you. And if you don't understand it, do call the insurance, because every plan is different. You could have, I'll call it ABC insurance, and there could be 10 people with ABC insurance, but there's 8 plans under ABC insurance, and we don't know what each plan covers for it. So they need to ask questions on it. You know, does this pay for outpatient radiology? How much out of pocket is this going to cost me on it though? Do I have to go to a specific doctor? What are the guidelines that I need to know in order to help myself or even my physician take care of me? Yeah.
So you have a whole team of billing and collections folks that work with this day in and day out. Walk me through what a day in the life in your department is like.
So first of all, every morning, in my department, we have coders who code all the x-ray reports. I have payment posters. They post all of the payments that come in, whether it's through the insurance company or whether it's the patients on it. And then I have billing clerks. We have some that do nothing but answer the phone and triage it to the collectors. And they're the ones that work with the insurances. Then I have a team that posts the charges on it, because we bill out every day. We bill out quite a bit too. But in order to have clean claims, somebody has to go in and make sure that the authorization numbers are in the right slots, make sure that they're linked to the correct plan.
So as a patient, I could come in, I could pay what I think is what I owe towards my deductible, and then 30, 45, 60 days later, I could get a bill in the mail from Steinberg.
Yes, that's correct. And that's because at the time of service, when we go out and check what you have to pay or what we think you may have to pay, this is based upon what your insurance is telling us, that it's an estimate. So they'll look to say, oh, your deductible hasn't been met. But what we don't know, and maybe your insurance doesn't know, that there's a claim lying around somewhere on somebody's desk that hasn't been processed. So we may tell you, you owe $450, you pay that, but by the time our claim is sent in, the bill that was sitting on somebody else's desk has already satisfied your deductible. But we will reimburse your money back to you for it. And then sometimes when the insurance process, they're like, oh, we made a mistake. You owe more than that. So there's a good chance you could either get a refund or you could get a bill for the balance on it though. Yeah.
So if somebody is watching this and they say, that sounds like the department for me, I want to work for Debbie at SDMI, what advice do you have for people that are considering medical billing and collections?
Well, for medical coding, I would say, because I only hire certified coders, so they may have to go to school for that. We do have entry-level positions, and our billing clerk one is the beginning of that. And that's where we'll train you to answer the phone, to look at the accounts. It's a learning process because you're getting the same questions every day. And after a while, it's pretty easy to pick up on, you know, like, oh, I see, this is what's going on. And so we do try to cross-train. We do cross-train a lot of our people on it. My billing clerk twos have gone on to become payment posters because they do have to work with the money, applying the correct co-pays to the line items and stuff. And so they're getting an idea of, oh, okay, this is what the payment posters do all day long for it. So I would tell them that, you know.
So medical coding is something that you have to go to school for, that you have to be certified in.
Yes.
Why is that?
Because there are so many laws and rules on how to code, and especially when ICD-10 came out, and ICD-10 just breaks it all the way down. So you had an accident, but were you in the front seat of the car? Were you standing on a curb? Where were you really when this happened on it? I mean, it drills down to the very smallest, what could possibly be wrong with you. Yeah.
And ICD codes are telling insurance why you're having a procedure done.
Exactly. So we take a report that's with letters, and then we assign numbers to it, which tells the insurance what's wrong with you. So you could come in for a chest x-ray, and the doctor will say that you had chest pain, or you had a cough, or you had whatever the symptoms were. But even if it's negative, then we would code it under the symptoms. So your insurance would know, well, this is what was going on with them. And if it's something even more, then maybe if it was a PCP that referred you, he now knows to send you to a specialist for it though.
Is it possible that a doctor could refer a patient over for something with a code that insurance ultimately says, nope, we're not paying for that?
Right. There are codes that the insurance know, and they're called Medicare has, they call it local coverage determinations. And then there's a national coverage determination. So they take a bank of procedures like chest x-rays and different MRIs and even PET scans. These are the only reasons that we will pay for it though. And so what we do, we have the patient sign what's called an advanced beneficiary notice, meaning that we've told you before, you're coming in for a chest x-ray, but it's only for screening and your insurance won't pay for it. And then we give you, say, do you want to have it still? And then there's a form that you sign and you check off, I still want to have it, and we put down the estimate amount that it will cost you on it though. So you're notified up front and you make the decision. Or different diagnoses they won't cover either. So they do tell you. There's a list that you can go out and see and say, okay, this is not going to be covered. So it's important that we educate our patients. Yes, you have insurance, but your insurance doesn't pay for everything that the doctor orders. The doctor is doing it because it's good medicine, but that doesn't mean that your insurance has to pay for it. Yeah.
And is it safe to say that most doctors, they don't know the nuances of every patient's insurance, so they are making decisions just based on good medicine?
That's it. They're making the decisions based on good medicines, but they leave it up to you. Do you want to have it or not? Yeah.
One of the foundations of SDMI is focusing on the patient experience. How do you feel your department impacts the patient's experience?
It impacts it a lot because when most of the patients, when they call us, they're not really happy because they're upset about it. They'll say, I didn't have this procedure, I only had one. And then we're having to explain them, well, you had an MRI of your cervical and your thoracic and maybe even your lumbar. But because the patient wasn't taken off the table, put back on, off the table, they think they only did one. So for us, we have to know a lot about how the procedures are actually performed so that we can help the patient understand what was done to them at the time. And then on some of it, especially in special procedures or biopsies especially, they come in and the only thing that they're concerned about, I pray my test is negative. I don't want to get a cancer diagnosis. So I'm up here telling you, this is what we're going to do, and we're going to inject this in your arm, and then we're going to scan you, but you're just hearing, I just want my test to be negative. I just want my test to be negative. So when they get the bill, they're like, did they do all this? I don't remember all of that. And that's understandable because they're going through a lot. I mean, I talked to a patient day before yesterday. It's really heartbreaking. She had, well, yesterday she went for her 16th surgery, and she wanted to call and talk about her bill and just about her journey for this. And so sometimes we just have to take that 10, 15, sometimes 20 minutes to let them tell their journey that led up to them coming to us on it though. But it all works out because that's what we're here for. We're here to say, how can I help you? What else can I do? Can I pray for you? Can I give you some wording on it? What has your insurance said? Can I call someone for it? To just go that extra mile. Yeah.
How do you handle the emotional impact of talking to all of these patients and hearing their stories and learning that people are going through 16 surgeries and are getting bills they can't afford?
I get up early every morning and I spend my time in prayer. And that's where I have to unload it because I feel that that's what I'm called for. And it's so much easier to hear that and to tell the people afterwards. I give a lot of people my direct number, some of them my cell number, and said, hey, if you need to call, because I know what it's like. You wake up at 1 or 2 in the morning or whatever, and you feel like you need to talk to someone about it and stuff on there. There's a lot of caring people here. We all care in our own way on it though. But some of us have a little bit more time than the others on it though. And that's what's really important, that we care about people. That's why we're in this business. We care about your health, whether it's a patient or a fellow employee.
Yeah. Do you have a patient that really stands out as your most memorable?
Oh my gosh, there are many. I got a call a few weeks ago, and it wasn't, well, she's a patient now, but she wasn't I guess she was, I just didn't know her. And another person had referred her to me just to talk to, because she's going through a lot of cancer patients, a lot of cancer patients on it though. And so now she's somebody we've never met, but we communicate by phone, and that's good for me on it though, just to let someone know, hey, I'll help you with your bill. I know the process. We're here to help you, you know? We're here to help you. And I like that we have such loving, caring techs. Oh my gosh. That just makes a world of difference. That, you know, everybody from our front desk people all the way, even our schedulers, yeah, you may have to be on hold a lot because there's someone else that they're helping, and they're going to give you that same amount of time for it, you know?
How do you think the organization has instilled those values in the employees?
Oh, we talk about it all the time. We listen in on phone calls, and we try to tell them, you know, I was talking to a couple of my staff this morning and trying to tell them, you know, picture yourself in their shoes. Everybody has had a bad day, or you've been presented with some bad news. How was it presented to you? Who was around to comfort you? Who was around to help you through that? We are those someone that's around, that's comforting. We have to be that listening ear for it. Yeah, we have to be the listening ear.
What has SDMI taught you?
A lot. Because when I started, I could type and do shorthand, 100 words a minute, 90 something on a typewriter, which was good because that's what we did on it though. But to educate me about the different procedures, because back then, way back then, I helped the techs. I helped Dr. Leon do procedures. I mean, we do an upper GI. I learned how to work the dark room. I learned how to do fluoro with him. I changed the spot films on it. You know, a lot of different procedures, arthrograms. I was the one that was shaving the knees and prepping patients and stuff on it though. So I got to see how all the procedures are done. So when somebody would call about it or even ask, well, what does this word mean? Tell me what happens. How long am I going to be there? Am I going to be able to walk, talk, and breathe after I have it? Well, yeah, I could do that. And then I always had a hunger to learn more. So we had a lady that did the transcribing, and I thought, I type. Those words don't seem that hard. So back then we had, you know, recorders. We put the thing in our ear, and I transcribed all the reports for that day. And I was like, wow, this is easy. So then as billing came along, I was reading books all the time. How do you do this? How do you do that? You know, what are the laws? And getting the laws down. Okay, you can't do multiple procedure. Why do we have to take a discount on that? Learning what all of that meant.
What advice do you have for patients?
To know your plans, number one. When you get an explanation of benefits and you read it and you're thinking, why do I still owe this? Call your insurance first and say, is this correct? Are you finished processing? Because what we found, like we can do a procedure and it could have 3 or 4 CPT codes on it, and they're processing one code at a time. So you need to make sure that they've processed all the codes for that day, that they're totally finished with it before you call us. Because you're saying, well, why do I still have this balance? Well, why didn't they process that? I don't know why they didn't process that. That's a call for them. And we're more than willing to do 3-way conversations with your insurance to get them straightened out on something. No, that's not what that means. Because what I found that radiology is a totally different animal with insurance companies. And we have to train them as well, you know, as to what we did and what we didn't do. And, you know, we won't even go into some of the biopsies and special procedures and stuff on it though, yeah. Because member services doesn't know everything. They're there to help out, but they may not know everything for it. Yeah. So.
Is billing something that you thought you were going to be doing?
You know what? I didn't think so in the beginning, because then I did a little billing, I did transcribing, but I really liked the billing because it was challenging. I liked the collection because I felt like you had to be a detective. And I would look at the claim and say, why are they denying this?
You were here from day one, from before day one. How do you think Dr. Leon's vision has been fulfilled?
I believe it's been, oh, don't make me cry, because I miss him terribly. I miss him terribly.
You think that
he had a dream, and he saw it being built, and it could be, and people would, I would go to conferences and they say, what? You have a freestanding imaging? So how many facilities net then? Maybe we had I'd say 7. They said, oh, so at these 7, so 4 of them are just do MRI? I went, no, they do everything. Wait, what? We've never heard of such a thing. And then when I told them, I said, yeah, we do angiograms. What? On an outpatient? We do biopsies, we do this. How are you doing this? How do you, and other facilities would call us and say, how did you do this? How do you set up your billing? So it has grown, and the vision is beautiful, and I can see it still growing. It just take wings, and as the valley grows, we have to keep up with the valley and the demands of the population that lives here. And so we can't just have one center that just does only MRI. We want to be able to offer you all that we do, you know? And so that's what we do.
What do you think the future is for Steinberg Diagnostic?
More imaging centers, definitely. Definitely more imaging centers on it though, yeah. More technology, more imaging centers, yeah. Faster way to do things, just easier access for patients, because now with all the different patient portals, patients can go on, they don't even have to call up and ask billing to send them anything. They can go on, they can print out their own stuff, they can get their own reports, they can see this, they can even schedule their own procedures. Yeah, that's come a long way. We used to have a book, and then we went from the book, then we had a cardboard that was probably the size of the screen, and we would write on, we had 3 of them, you know, for that time we only had three sites but now that we're actually scheduling inside of a computer and being able to see the workflow, we can see how long somebody is stuck in, in this waiting area. We can track things more.
What do you want to say to somebody who is considering going into healthcare as a field or as a career?
I would say I pray you have the right heart for it, that you care about people and not so much a paycheck. The paycheck is important, but you need to really care about the people so that you can make an impact in whatever you do. I don't care if you're just the tech aide, you're walking them down to the room to get the procedure, to change into their clothing on it and stuff, to have that listening ear, to hear what they're actually saying as to why they're there. Because whether you believe it or not, I would say 85 to 90% of our patients are scared when they come here, because we're going to take a picture of something inside of your body. I can see if you're not feeling good, if you've got a mole on your face or, you've started to break out in something, but I don't know what's going on in the inside of you. You just know something is not right, and you're going to go and find out from it. So you're thinking, okay, I pray everything is right. And then you get put in a waiting area where there are other people there all waiting for the same thing, and you're told to drink this stuff, every so many minutes, and you're like, well, what is this, and what is it going to do, and then what happens afterwards on it, though? That's what I would tell them, to be very caring, make sure you have patience, and that you have a love for people. Don't come here if you don't like people. You need to go work for, I guess, a garden, because I wouldn't even say animals. You got to care about animals too, right? Yeah.
What has been the most fulfilling part of your career?
When people call me back and say, thank you, I understand, and I'm all better, I'm all well, your department was great. I was having a rough day that day on it, but somebody took the time to listen to me. Yeah, that's what I like to hear. Yeah.
How do you keep a positive attitude in your department? How do you keep your people positive and focused?
I try to tell them to put yourself in the other person's shoes. I try to be the one that, if you can't figure it out, give it to me and let me try to figure it out for you. How can I help you? What can we do? Let's sit around and brainstorm on this. And to say my door is always open. Call me, come in. Tell me what's going on. Tell me the challenges you're having. I don't want you to struggle. I'll jump in there and fight with you.
So I like to end all of my conversations with one question, which is, what would your younger self be most proud of you for or most surprised by?
Gonna make me cry.
Sorry.
I just thank God for his love for me and for Dr. Leon. Everybody said he was so gruff, but he made us all tough. But he was a teacher, and he cared about his employees. Because when I worked at the hospital, and some of the staff were at the main office and stuff, and they would tell him at the hospital, you can't hire any more people. And he goes, I need X amount of people to make this department go. And they were like, no. He goes, I'm going to do it anyway, and I'll pay them out of my pocket. And he did. And he took the time to have one-on-ones with us, to say, what's going on? I'm hearing snippets. And they'd say, I tell everybody, make sure you tell him everything. And they'd go, okay. And they would, and he would fix it. He was fighting the administration, and he would try to make sure the departments were better, that the employees were happy. Because then they would work. You want me to work overtime? You want me to do this? Because he would be right there with us. I remember I went on was at the hospital, and I went on a shift. I started working, like 8 to 5, but then I went on a shift 3 to 11. And on Friday night, doing all the x-rays, I worked with 3 guys, 2 x-ray techs and 1 orderly. And I was just working the dark room, but they taught me the front desk, and then they taught me the dark room. And it would be busy because it would be all these, you know what the ER is like. And all of a sudden, there would be Dr. Leon. We're like, what are you doing here? He goes, I just come to check on you guys. You guys busy? You're really busy, And this went on. And then even after we opened Maryland Parkway and the other offices, I can remember Mary Hartsock was the person that did the cleaning, and we came in real early in the morning and stuff on it. And one morning he came in like 5 or 6 in the morning, and he's like, just trying to see, what's going on here. I said, well, this is what we have to do every morning. But he cared about us. I was thinking about you guys in this building by yourself. And I remember once when we were just opening Maryland Parkway, Lona and I was having to put all the charges and create the macros and stuff. And we would work at Rancho all day long, and then we would come over to the Maryland Parkway office, and he goes, now I'm going to lock you in here, but I'll come back after the basketball game and let you out. And we're like, okay, we'll do that on there though. But he was checking on us always checking on us. And then sometimes when he didn't want to go to the basketball game, he'd give us his tickets. So that was just, he set it a good example. So that's the role that we modeled ourselves after, Yeah. Somebody they don't have it. You don't have lunch? I can buy you lunch. You need a new top? Okay, we can get together. Right? You don't have an iron? I have 2. I'll buy you one on it though. And from there, we created this funding. When Dr. David heard about it, where any of the employees were in need, there was a committee. Yeah. Because he said, I don't want you guys doing it anymore. I will do it. So it's a lot of caring, loving people here. And you need a box of tissue right there too on it though. Yeah.
Next time.
That's not fair because I'm not using my sleeves.
Next time. Well, thank you.
And to have an attitude like you, because you have a beautiful smile, and when you smile on people, no matter what they may be going through, they feel good about themselves. So you keep smiling.
Yes, ma'am.
Okay.
Thank you so much for your time today.
Oh, you're so welcome. I enjoyed it. Yeah.